Silence that. Silence that. Alright. I got the avian flu! 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 Bird flu! Bird flu! Bird flu! Bird flu! I got the avian flu! I got the avian flu! The avian flu! I got the avian flu! Bird flu! Bird flu! Bird flu! Bird flu! Yeah! Yeah! Bird flu! Bird flu! Bird flu! Bird flu! Bird flu! Ah!
The 1918 flu pandemic, often called the Spanish flu, likely started in Haskell County, Kansas. The first known case was reported there in March of 1918. Around that time, the United States had joined World War I and was sending soldiers to Europe to fight along countries like Great Britain, France, and Russia. These countries were part of the Entente Powers, a group that worked together against Germany and its allies. The war made it easier for the flu to spread. Soldiers lived in close and cold, wet and dirty trenches. Many were tired, hungry, and sick. The flu spread quickly from one soldier to another. Around 45,000 American soldiers died from the virus. After the war ended in November of 1918, soldiers returned home and carried the disease with them. This made it easy for it to spread among the people and the families of the United States and around the world. Doctors and scientists at the time didn't know what was causing the illness. There was no vaccines or treatments that could stop it. The flu acted fast. Some people died within hours of feeling sick. Others died in just a few days because their lungs filled with fluid. In the United States, about 25% of the population, over 25 million people, got sick. Life expectancy dropped by 12 years in just 1 year. Globally, about 500 million people were infected, and an estimated 50 million people died between 1918 and 1920. Could something like this happen today? In some ways, it already has. In late 2019, a new virus called COVID-19 began spreading from Wuhan, China. Like the 1918 flu, it spread quickly, but this time it traveled through the modern world by airplanes, cruise ships, cars, and trains. Some people moved across cities and countries faster than ever before, making it easier for the virus to spread worldwide. By early 2022, more than 600 million COVID-19 cases had been reported worldwide. In the United States alone, over 111 million people got the virus. The number of deaths in the U.S. passed 1.1 million. Around the world, COVID-19 killed over 6.5 million people. Some experts believe the real number may be even higher due to unreported cases. COVID-19 was especially dangerous for older adults and people with health problems like heart disease, diabetes, or asthma. Many hospitals were overwhelmed, especially in the first year. In places like New York City, emergency rooms ran out of space. Doctors had to treat patients in hallways, and ventilator machines were in short supply. However, there were important differences between COVID-19 and the 1918 flu. Today, science and medicine are far more advanced. Scientists quickly found the virus's genetic code and started working on vaccines right away. In less than a year, several vaccines were made, tested, and approved for emergency use. This was one of the fastest vaccine rollouts in history. Over 13 billion doses of COVID-19 vaccines have now been given around the world. These vaccines helped lower the total number of deaths and serious illnesses. Governments also took steps to slow the spread. Schools closed, events were canceled, and many people worked from home. People wore masks, washed their hands often, and stayed 6 feet apart in public. Even with these efforts, the virus still spread quickly, and misinformation about vaccines and treatments made things worse in some areas. Both the 1918 flu and COVID-19 show us how dangerous a virus can be. They also show how much easier it is diseases to spread in a connected world, whether it's soldiers in trenches or people flying on planes. Being close to others helps the virus spread from one person to another. While we have better tools today like medicine, vaccines, and global communication, we still face many challenges. Not all countries have the same access to healthcare, and not everyone listens to medical advice, which makes it harder to stop the spread. These two pandemics remind us that we must stay prepared. Learning from the past, investing in public health, and working together as a global community are the best ways to protect ourselves in the future.